I am still reeling from your incredible TED Talk at NatCon, where you talked about crisis care doesn't come in handcuffs. David, that was outstanding.
That was a lot of fun, John. I was quite a rookie though, going out there with my microphone off.
Well, actually, it fulfilled a lifelong dream of me to watch you come on the stage with handcuffs.
And then on the way home, John, I was flying a Delta jet that got struck by lightning.
Oh my gosh.
Let's get this
Well,
show going, John.
I'm so glad that you made it back.
Welcome aboard Lifelines with David and John, your guide to charting the transformative course of crisis intervention and the game-changing 988 Lifeline.
Welcome back to Lifelines, the 988 podcast with David and John, where each call brings a new beginning. Lai Fong from the heart of Atlanta, Georgia, where the Delta jets fly, and stretching out not just across the United States, but around the globe, we're diving each week deep into crisis intervention, exploring the rich history and the promising future of not just crisis care, but 988. We're your hosts. I'm David. I'm here with Brooklyn, Dr. John Draper, who helped raise up the National Suicide Prevention Lifeline over the last many decades. And we're here today with an amazing guest that I've known for many years. In fact, Professor Chan Lai Fong, I think one of the first times we were together for an extended period of time was in Atlanta, Georgia, back in 2015.
Yes, I remember that very well. It was one of my first experiences being immersed in zero suicide and being exposed to it. And my first ever interaction with Jan Mockensten, the late Jan Mockensten, I was absolutely inspired by that man. So I have great and fond memories of that time.
We miss him.
I had not intended, that wasn't on our plan for today, but we should talk a little bit about Jan. But this podcast, we're on YouTube if you're watching us, or you're on any of your regular podcast forums. Like and subscribe. Join us here. We get together every week. And we're brought to you by Behavioral Health Link. But this episode 4 is going to be a lightning strike, John Draper. John, this amazing guest is a vice president with the International Association of Suicide Prevention. Professor Chan Lai Fong is a practicing psychiatrist as well as researcher. And you've been around the world doing this work, both with Zero Suicide and IASP. And we're gonna build off of some of that today. John, what's your first recollections of Lai Fong?
Well, my recollections again, Lai Fong, was you're joining us at that 2015 event, which was so special in Georgia. And you mentioned Dr. Jan Mockenstorm, and I again, there were so many things that were inspiring about that zero suicide event. But him saying that and really giving us kind of the headline, the mission of zero suicide, which is that no one should die alone and in despair. And to have you and people from all over the world aligning ourselves behind that mission really felt like it was a moment. And I'll never forget it.
Yeah, I think that what struck me the most was when he opened up and shared about his own lived experience. And I think that was the first time ever I was exposed to anything like lived experience, because it was totally alien to me before that. And I was just blown away.
Lai Fong, was that in your country since then? Have there been more professionals coming out and talking about their lived experience with suicide?
Yeah, definitely. I think that the movement of lived experience has definitely escalated in the past couple of years. People are gaining courage, and I would like to think that the stigma level is coming down. And probably we don't have too much time to dwell on it, but I do have my own lived experience as well. And sharing about it and just, coming out was really cathartic to me. And I have had many friends who were very, very supportive, and it was just life-changing for me.
Well, let's come back to that, John, as we get into the program. But let's start with how we get to be here. Our sponsor, Behavioral Health Link, and the Crisis Software Platform.
David, I was thinking about a couple of things going in today. I was thinking about your outstanding TED Talk at the NACON conference and how behavioral health care shouldn't come in handcuffs. And I was also thinking about our guest today, Dr. Chan Lai Fong, who has looked at the cultural factors of suicide across the world and who has reminded us that suicide is still against the law in many nations. While we have a long way to go here in America to keep police out of behavioral health emergencies, we are still ahead of many other countries in our suicide prevention efforts and crisis technologies. Our Crisis Now Ready BHL Care Traffic Control software platform is helping communities across America to build an alternative infrastructure to a law enforcement response for behavioral health crises. Our innovative call center module helps counselors reduce a person's distress in the moment. Our mobile crisis GPS-enabled dispatch module helps communities get the rapid crisis response that they expect when they call that other 3-digit number, 911. And our follow-up module can help counselors to keep people we serve safe and stable in the community after our call or after our mobile visit. I'm really looking forward to hearing what people at our Crisis Now Global Leadership Exchange Summit in Amsterdam think of our BHL platform when we meet in June, David. I imagine some are going to be ready for it, and others there will give us new ideas for innovation, while others will be looking forward to their Crisis Now tomorrow. See if you're ready for the Crisis Now platform today by going to our website at behavioralhealthlink.com. David?
Great, John. And Lai Fong did connect us with some leadership in Malaysia who are helping raise up a crisis care system. Who is joining us in Amsterdam, Lai Fong?
Yeah, Dr. Nur Raihan Kamal, who is working with the director of the National Center of Excellence of Mental Health, Dr. Nurashikin Ibrahim. So what happened is about 2 years ago, we have had the first so-called national crisis line built up from scratch. It's something that Malaysia is very proud of. We have various helplines and crisis lines, for example, Befrienders, Lifeline International, and so on and so forth. But Talian Heal, which means lifeline, literally, no, how shall I say, healing line, is the first ever government funded and sponsored national crisis line. And exciting things are coming out from there.
Terrific. So great that you raised that issue, John, because our trivia question, this over-under, is going to be in that very space. The World Health Organization released a report last year that we could put on the screen that talked about decriminalizing suicide and suicide attempts. So, Lai Fong, the way we do the over-under is I'm going to give a trivia question, and John is going to give a number based upon what he thinks is his best guess. Your job is to say that number is too high or too low. So you want to go over that or under that. If John hits it dead on, then he wins. But that's the way the game works. So, John, in the policy brief from the World Health Organization, how many countries still criminalize suicide and suicide attempts? What's that number, John?
I'm going to say 23.
Okay, so Lai Fong, is it higher or lower than 23?
I'm going to say it's spot on.
Oh, we have a tie today, John. John, did you do your homework?
I did. Yeah, I didn't know this was going to be the question, but I was really interested in today's topic, so I did look it up.
So, Lai Fong, this is an ongoing story. The government of Malaysia raising up a crisis line in a formal way. I did have the opportunity to listen to the excellent podcast with Roy O'Connor that you did, and you were talking a little bit about the status of where Malaysia is. Can you tell us a little bit about that story and what the way forward is?
Sure. Yeah. So, I mean, back since 2016, there was interest from academicians, policymakers, and even the police themselves. and lawmakers in decriminalizing suicide attempts. So in Malaysia, suicide technically is not criminalized. It's only suicide attempts. So it's, I think we all know from the background of common English law, same with the Indian law. And so there has been, I think from my perspective, a huge paradigm shift in 2018 when there was much greater political will, when there was a big government change. We had one of the biggest government changes in our 55 years since we were sort of like free from British colonization. So then I think there was also one very significant, very sad and tragic incident where a young life was lost to suicide. And there was a lot of media frenzy over it. It even sort of resulted in Instagram. I'm not sure board members or the powers maybe of Instagram being kind of dragged to Parliament in the UK because this young person put up a poll on whether she should or should not die by suicide. And the poll was more than 50% and she died. So that generated a really intense amount of media frenzy. And that, I think, was a tragic incident that sort of made everybody really sit up for once. And it galvanized the efforts in suicide prevention very much. And one of the top leaders, in fact, it was the deputy prime minister who said herself that one of the KPIs that the government must do is to decriminalize attempted suicide. So I think from then on, the shift happened. And then there was a lot of technical nitty-gritty that got involved. But basically, to cut the long story short, there were many models in the world that we could follow. And we were debating about whether it was a Singapore model where the law that criminalizes suicide was just repealed, or we follow the Indian model whereby the Mental Health Act is actually sort of improved so that people are not put behind bars.
Right.
So we came up with a kind of like a hybrid model after a lot of discussion, and the Penal Code 309, which criminalizes suicide attempts, was completely repealed. That was a big win in our country. But we realized that for crisis care to be safe for people in crisis, the Mental Health Act had to be sort of amended to empower the frontline crisis responders like the police. And there was added to the police, the firefighters, the social workers, maritime, as well as the, slips my mind, but basically the frontliners that respond to people in crisis.
Lai Fong, one of the things that's so important about decriminalizing suicide is so people feel safe to go seek help. But even after you lift the laws criminalizing suicide and suicide attempts, there's still, I imagine, a lag in the culture before people feel it's safe to come out and go seek help. What has been, there's been a shift culturally, but to what extent has that affected help seeking for suicide prevention there?
That's a really good question, John. In fact, I'm planning to do a study with my postgraduate to actually look at the pattern of crisis helpline callers before and after the criminalization of suicide. So I don't know the answer yet, but I think that the public and the NGOs and the people with lived experience really came out in full force. Some of them actually walked the parliament halls to just, grab politicians and try to lobby and advocate for the 309 to be repealed. So I think that if you're asking about how generally the public feels about it, everybody is very positive about it. But there's much work to be done because we're still taking infancy steps in terms of having a good crisis care model.
What is that like for you, Lai Fong, as a psychiatrist, when you're working with someone who you're afraid there's some imminent danger? What does that actually look like practically day to day?
Yeah. So when you ask that question, I remember our medical student who happened to be a patient and how afraid I was for her safety because she was at very high risk and she was living alone at the hostel and everybody was going back for the holidays. And I think we spent more than an hour. No, definitely we spent more than an hour, and it involved me getting the interns to call the family from outstation to come and make
Right.
sure that they pick her up and stuff like that. So it actually, I feel afraid for the patient, and I feel that I always ask myself, am I or is my team doing the best that we can in terms of safety planning for this patient? And one of the stories I like to tell is one particular person who had bipolar disorder, bipolar depression, very treatment resistant, and we were giving him electroconvulsive therapy. And that was one thing that he hadn't tried before. So over the weekend, we gave him home leave. And he said that at one point he was just really about to attempt, but he suddenly occurred to him that I haven't tried ECT, electroconvulsive therapy, before. So I have a little glimmer of hope. And
Right.
then just,
Something that might make a difference.
yeah. So he just aborted the attempt and called befrienders. And in that 15 minutes, befrienders managed to de-escalate the situation, and he slept a good night's sleep, and he came for ECT the next day.
Wow.
So that example, I like to share this example because I don't know how much I can express how important crisis lines are to people in crisis.
Lai Fong, that story you just told, I'm so glad that you try to share that story everywhere. And I know you're familiar with Dr. Thomas Niederkrotenthaler, and we'll have him on the show soon to talk about this very thing. But it's not just about, I mean, you've done a lot of studies on the media impact on suicides, and that they can actually generate suicides by talking the way in which they present suicidal behaviors and suicides themselves. But what Dr. Niederkrotenthaler talked about with the Papageno effect is that if we can talk about ways in which people have gotten through those suicidal moments, when treatment has worked or reaching out for help has made a difference and they found hope, it gives them a reason to hold on and also gives them a reason to seek help. So it kind of relates to that question I just asked. Are you actually, how are you getting out and helping to invite people into treatment and to come out with these stories?
Well, I think that the people with it themselves are the go-to people that we try and engage and try and portray and give them as much publicity as possible because they tell the real life stories. One example I would like to share is her name is Alia, and she's somebody who has been bereaved by suicide, and she has an NGO by the name of Awas, one of the first NGOs in Malaysia that actually reaches out to people bereaved by suicide. So during the World Suicide Prevention Day 2 years ago, we invited her to make a video to open and launch the day. It was so powerful and so impactful because she is giving voice to people who are voiceless. And she is sharing her story of how she lived through the suicide of her loved one and her own internal struggles with mental health challenges as well.
We met her, Lai Fong. You introduced us relative to the Moving America's Soul and Suicide series.
Yes, we did.
You were also referencing Dr. Jan Mockenstorm and his impact earlier. Lai Fong will be at the Zero Suicide Summit in Liverpool where we'll lift him up. But talk a little bit about his impact in your work and in your life.
Yeah. So it was the first time ever at Zero Suicide Atlanta 2015 that I heard a psychiatrist stand up and say publicly that he had experienced suicidal ideation in his lifetime during a crisis. And I was like, wow, it's so brave of him to actually say that. I mean, the first thing that flashes through my mind is what would others think of him? Would others think of him of being incompetent to treat people who have suicidal behavior? So it really just blew apart, all the sort of negative stereotypes that I have in my head. And so when I was struggling through my own mental health challenges, I always remember what Jan used to say. And just before his passing, we were exchanging a bit of text and all that. And I just can't tell how much impact he has made in my own life and in so many other people's lives.
Lai Fong, he really has. And I think to your point, what that we say, it reduces stigma, but it also gives people permission more than anything to be human and to be seen as humans and to be able to treat others as humans. And I wondered, after you were inspired by him to talk about your own experience, if you could talk to us about how coming out was for you in talking about that, and then what impact you think you've had on your colleagues.
So I think the first time that I came out properly was probably 2 years ago in an ISB conference. And I was talking about the impact of COVID on suicidal behavior among healthcare workers. So at the end of the, say, 20-minute odd talk, it was all online because it was during the pandemic. So I just shared, I think in less than a minute or so, that I was seeing a psychiatrist, I was seeing a therapist to deal with my own mental health issues. And when I made that video, I thought to myself, now, okay, this is going to go all over the world. Everybody's going to know. Am I prepared for that? Right. And I had to talk through with my therapist. How do I become comfortable in my own skin? And, after that, would things change? And how would I feel about other people knowing about my mental health challenges? Would I feel small? Would I feel less competent? All those questions came through my mind. But I think that after I did that, and when I shared that sort of video with some of my friends and colleagues, all of them had very positive sort of feedback to say that, Lai Fong, I'm very proud of you. I'm very proud.
Yeah.
To just, share this little bit. And I'm still on that journey of like, how much should I share and in which kind of audience should I share this? Do I feel safe enough? And before I actually released the video to the organizers, I was struggling with how to tell it to my boss.
Yeah.
Because my boss hadn't known yet that I was seeking professional treatment. So I was scratching my head, and then I thought, okay, I've already done it. I just show her the video. That's it.
That's it. That's it.
Yeah, I just showed her the video, and she was silent for a couple of minutes. And then she just said that, Lai Fong, you do know, right, that some of our colleagues are also seeking therapists. So, and then I felt that I was not alone.
So Lai Fong, let's come back to that topic, because it's part of the work that you've been gracious enough to help us with in the project of moving the world's soul on suicide. And you went on to speak in Slovenia on that topic as well. So let's come back to that. It's time for some good news, John. And last week, Lai Fong, our good news was completely different and totally the same. It was the completion of the suicide deterrent safety net underneath the Golden Gate Bridge. An icon that historically has had deaths every 2 weeks on average, and we've had, I believe, there's been one death since the first of the year, as far as we know, John. So, but today's good news, if we can put that on the screen, is this is actually a news report from last year. But Malaysia's deadly pesticide ban has helped prevent deaths, new study suggests. And Professor Chan Lai Fong is quoted in the article. John, let's get just a quick thought from you, and then would love to hear Lai Fong's thoughts on what happened in Malaysia in 2020 and the impact of that.
Yeah, I'm very interested in hearing you talk about that, Lai Fong, because when we talk about population level approaches to reducing suicide prevention, are there national policies or approaches that we can take at a broad scale level, like with media or with reducing access to lethal means, or by creating more access to life-saving means through crisis lines. I, I really want to hear more from you in a little bit about, with all of your studies across cultures, what do you think is the most important thing we can do at the population level to prevent suicide? And it sounds like this is something that did work absolutely in the country you're from.
Yeah, so to answer your question, John, I think that the evidence out there through lots of systematic reviews have been done have shown repeatedly that reducing access to lethal means is one of the most evidence-based ways of actually preventing suicide. So what happened in Malaysia was in 2020, there was a ban on a highly lethal pesticide. And again, I can't help but attribute it to the political will in the country at that time. It was post 2018, post change of new government. So with the gracious and really appreciated funding from Center of Pesticide of Suicide Prevention, University of Edinburgh, where Professor Michael Edelson and Leah heads. So we were able to actually look at records from two hospitals, one in Borneo, in Miri, and one in Ipoh, and both are actually sort of more agricultural based places. So we were actually able to show through that study from hospital records that after the pesticide ban in 2020, there was a numerically lower number of pesticide deaths, even though statistically it was not significant. Unfortunately, we were limited by sample size. But I think this adds on to the body of existing literature that in many countries such as Sri Lanka, in China, and even in India, that when there is national or regional or a sort of a big scale pesticide ban on highly hazardous pesticides, it actually reduces suicides. And if I'm not mistaken, there is no method substitution in most of the studies I've shown. So it shows that the rate of suicide overall actually comes down. So it actually is a very effective suicide prevention strategy, especially in low and middle income countries.
It's so interesting that it sounds simple, that the best way to prevent suicide is just make it harder for people to do so. And we also wonder, if we make it easier for people to get access to care, does that make a difference?
Right.
And I wondered if you had any thoughts about some of the evidence related to improving access to care, either in your country or others, and what you've seen.
Yeah. So we have limited data from our country, but I think that we are still lacking data in this, if I'm not mistaken. If I'm up to date enough in this aspect, I think we have shown more evidence that making it harder to die by suicide with lethal means, that is very strong. That has a very strong effect. But I think in terms of the evidence-based and published literature, at least, um, it's still quite mixed, and that's why there is that argument that a more population approach, a broader sort of like less focus on the clinical population, that would actually garner more benefits. So as a clinician, of course, I would love to say that, of course, it's a no-brainer that if you make it easier to access care, there'll be less deaths by suicide. But I think we still need to build the evidence base to show that, especially in low and middle income countries.
Lai Fong, back in, oh goodness, it's been a minute, John Draper. We were in Beijing in 2011 for the World Congress of the International Association for Suicide Prevention. And one of the things that struck me was a group of Chinese researchers talking about that it had not been that long since the rate of female deaths by suicide in China actually outweighed the male death rate, and that we weren't aware of that happening in another country. And this issue of means restriction seemed to be pivotal to that. Lai Fong, what are your thoughts? Were you there in China in 2011?
Yeah, I was, but I didn't have the chance to meet you guys then. So my take on it is this. So some researchers have shown that it has to do with the more rural population of females who have more access to pesticides. There's one school of thought. And that when there is greater urbanization and more migration from the rural to the urban centers, the rates have come down. But I think that newer research from Ying-Ye Chen and her team from Taiwan, they have looked at OECD data, and they've actually shown something very, very interesting when it comes to this so-called reversal of gender ratios of suicide in China as well as some parts of India. So they have shown that if caregiving is more, how shall I say, gender equal, if men give more care at home to those who need it, the suicide rates are actually lower. So
Wow.
it actually shows that there is this issue of gender equality and gender, how shall I say, the normalization of roles and gender norms, especially in more conservative cultures. When you see that happen, suicide rates actually come down.
So we're talking about two different things here in this conversation, right? We're talking about keeping someone from ending their life, the net under the bridge, or the keeping paraquat out of the household where somebody doesn't have access. There's a wholly different line of making life worth living and a life that feels like I have value, and you're keying right in, Lai Fong, to how the roles in different countries can make life extraordinarily hard, or the opposite. It can make it worthwhile and full. And those impacts upon the way gender roles play out can really make a difference. John, your reflections on that?
Yeah, I really loved what you were just noting. I hadn't heard that before, Lai Fong. That really just turn on a light bulb, because as noted, in most every country, the higher suicide rate by several times the rate is much higher for males. And so again, you have this exception for females in China. And to your point, David, that life worth living, one of the reasons that we think that women are less likely to actually kill themselves, in addition to they're less likely to use a gun here in America, is that they also have reasons to live, the kids, so to speak. So if we draw the men more into caregiving for the kids, more of that responsibility, where they say to themselves, what are they going to do without me? It could actually reduce the rates of men too. What do you think about that?
I think that has a lot. I think it makes a lot of sense. I think it makes a lot of sense when it comes to masculinity and norms of masculinity and suicidality. I mean, there's so much to peel, in layers of onions in that respect. And the person that pops into my mind when you talk about male suicide, help seeking, and how to reduce rates is Zach Slider, I think his name is, in Australia. And they do a lot of work in Sydney, and also Movember, I think, is the organization.
Right.
They do a lot of work looking into how to actually understand and help males and men get help, because we know that a lot of studies have shown that it's the women who actually seek help more than men when they're in a crisis.
Right. Lai Fong, I would like to shift gears a little bit. You joined the Zero Suicide effort early on, and you referenced Jan Mockenstorm's his influence in that. But you were in Atlanta, you were in Sydney, you spoke in Rotterdam. Tell us a little bit about your affinity for that movement, and what drew you in, and what do you think the impact and way forward for Zero Suicide is?
Yeah, I really like that question. It was running through my mind actually as I was, trying to figure out, what to speak about and how the panel is going to go in Zero Suicide Liverpool in June this year. So I was very struck personally in a very deep way when I was exposed to the ethos of zero suicide. But I must say that in some circles of academia and more conservative schools of thought, there are academics who are of the opinion that there is not much evidence for the zero suicide model, at least in published literature. But as a clinician and looking through, the elements of zero suicide, that was where I learned to actually have a completely new paradigm shift of looking at prevention of suicide rather than prediction of suicide. That was one of the first lessons that I learned. And also, the late Barbara Stanley, who just passed on, her legacy lives on in safety planning. And that's like the 101 of suicide prevention that I teach my medical students and undergraduate students. I mean, no postgraduate or resident will survive in the department if they don't know what safety planning is. So, I remember so vividly when, we were having meetings and it was past 5:00, it was after hours. And then my resident calls and says that, there's this person who's suicidal and she refuses to actually be admitted voluntarily in the hospital. And so to cut the long story short, she had an education about safety planning and spent 1 to 2 hours actually doing a safety plan with the person, because the person was given 2 options in the most diplomatic way possible, because she came alone and we couldn't discharge her safely. And we didn't want to break the therapeutic alliance by forcing her to be in a hospital. And we know that being in a hospital doesn't mean that you're 100% safe either. So she was left with the option of us making a police report for involuntary admission or calling her husband, which she was very adamant that we do not call him. And finally, she allowed us to call the husband in. And then my resident was actually able to do a safety plan and see the patient in 2 days' time, and she survived.
Yeah, so it's tremendous, this intensive focus on bringing these basic tools together at Lai Fong. So let's go to a little bit more about you. We normally start the podcast, John, with our guests telling us something about themselves that others might not know. But let's do that now as we get into our either or section. What's something about us you'd like to share, Lai Fong, that maybe John and I and others aren't aware of?
During the pandemic, I attempted to learn to play the flute just all by myself using the YouTube and videos unsuccessfully, unfortunately.
Unsuccessfully. Well, you know what? Or successfully, right? What's your measure of success is the question. So, Lai Fong, one of the things we do in this rapid fire is try to get to the when Kevin Briggs was on, we looked at being a California highway patrolman. I think for this one, we're going to talk a little bit about Kuala Lumpur. John, I've been to Singapore, but I've not been to Kuala Lumpur. Of course, John, you and I were in Borneo together.
Well, I went to Kuala Lumpur. It was amazing. We had such a great time there.
It's such a diverse cultural landscape of Malaysia in that city. But let's look at the television and media a little bit. And we're going to play an either or game, Lai Fong. So we'll start with John. John, either or number one, Taylor Swift or Beyonce?
Oh, I love them both, but I'm going to stick with Taylor.
Yeah, so Taylor hasn't put out a country album lately, John. So what about you, Lai Fong? Taylor Swift or Beyonce?
I would say Beyonce. She's the woman.
Okay, so let's get a little bit closer to Kuala Lumpur. Formula One, Lai Fong, or badminton?
Sorry, Formula One or?
Badminton.
Badminton?
Badminton.
Oh.
Badminton. Oh my gosh. Of course, badminton. It is like the country's number one sport. Everybody plays it.
Yeah, you're not. Yeah, I like badminton too, but Formula One is my jam, John. John, you want to answer that one or not?
Well, I mean, I would take my Formula One race car to go play badminton, but I would definitely go with badminton for sure.
All right, so let's get even closer, Lai Fong. We have American Idol here. So big stage, Lai Fong, or Jangan lyric?
Oh my gosh, you've got me stumped. I don't know what those are.
It's a big stage is supposedly a singing competition show in Kuala Lumpur,
Oh, really? Oh my
and
gosh.
Jangan lyric is a show called Don't Forget the Lyrics. Do I have bad information? Did ChatGPT mislead me on television shows? And
I'll go for big stage. I loved American Idol, so
You should have asked American Idol, David.
all right, how about this one, Life? The Crown or Stranger Things?
I haven't watched either, but I'll go for Stranger Things.
What about these? Game of Thrones or Friday Night Lights?
Friday Night Lights. I haven't heard of Friday Night Lights, but
See there, John? It has not made it around the world.
No, it has not. It's a great show about Texas football, for God's sake. So yeah, not a big thing in Malaysia, I'm sure.
All right, Lai Fong, last one. Korean dramas or Game of Thrones?
oh man, I'll go for Korean dramas anytime.
What's your favorite Korean drama?
I can't remember. It's too long ago. I was a kid.
Does your household watch TV, or are you guys too busy learning the flute and other?
No, oh my gosh. I can't keep my kids off the screen. They're watching too much YouTube for their own good, I tell you. So it's actually, television is not a big thing now. I think it's really YouTube and anything that interests them. So yeah, really television is not a big thing.
Is it because YouTube they prefer the access to things from all over the world that are a little bit more has more variety than what they can get in Malaysia, or what is the reason for that?
I think that with YouTube, we can get very specific with what exactly you're looking for. So my kid comes and tells me stuff that he learns on YouTube that I've never heard of. So that's it.
So Lai Fong, if you could have your kids please like and subscribe our YouTube channel,
Okay.
where they watch their mom on podcasts. So
This is a family show.
yeah, exactly.
Absolutely.
So thanks for playing this or that, Lai Fong. Let's get back to this discussion of lived experience. Marsha Linehan spent her whole career not sharing that dialectical behavior therapy wasn't just a great research idea, but that she had developed it first to save her own life, and had not disclosed her lived experience for the very same reasons you were talking about when you heard Jan talking about his lived experience. She did not want people shifting their focus to her as a person. She wanted them to think about the strength of her work, and ultimately, after she came out in the New York Times in 2012, she spoke at the American Association of Suicidology conference a few years later, and she was both proud of and regretful at the same time. What does it take, Lai Fong, for us to get to where we have a healthier support for one another and openness to give this caring without judgment? What do you think the steps are for us to continue making that progress? I think we're making progress, but how does that keep going?
I think that we could do with much more empathy, that we're all human souls, and that I love Ahmad Hakir, if you've heard of him, the wounded healer. I really love his work, and I had the chance to be on a panel in Piran ISP last year with him. He's amazing, and I think I'm just going to plug his new book, Breakthrough. It's just come out. I haven't got it yet, but I'm sure it's going to be fantastic. So I think there needs to be so much more, how shall I say, slack that we should cut each other, and that this sense of false perfectionism, that we strive to be perfect in every way, no flaw. If there's any flaw, then it's not going to be good enough. I'm not good enough for anybody, and that shame that shame that comes, bearing that shame that, I have been through the depths of despair myself, even though I have been trained to the best of my ability to treat someone else who's been through that. Why is it that I have to go through this despair? Is it because I'm not good enough as the clinician? Is it I'm not good enough as a human being? Why? So I think that if we can just, get it across that falling sick and having a mental health challenge can be a superpower. It can be a superpower, and having that lived experience gives you a lot of post-traumatic growth that gives you that lens of empathy. And, when you see a patient, you don't only see a patient, but you see a kindred spirit, and that you can connect with this person and know that, hey, this is not just another patient that I'm treating, but this is also a kindred spirit that has gone through the depths of despair that I have gone through, or who have gone through depths of despair that I've never gone through. So I'm going to really cut some slack for this person and just give him or her space to heal.
Yeah.
I love that, Lai Fong, and again, I want to just reinforce that message of empathy and what that means in this context, because when we think about medical doctors, for example, and treating cancer or heart disease or something like that, we don't. I mean, empathy's fine; it's good. It's a value add, but we really want them to be able to read test measures, to be able to accurately evaluate them, and know exactly how to perform procedures that can save lives. In our profession, it's really about understanding. People want to feel understood. People want to feel like you can connect with them and that you don't judge them. So if they know that we too have been through this, there's more likelihood that we're going to feel understood and that we're going to feel connected to. So in many ways, our ability to be open about our experience, if it's properly chosen and how we say it at the right times in the right ways, that it actually is a value add in so many powerful ways. What do you think about that?
Yeah, absolutely. I mean, even listening to you say all that, there have been so many times that in the depths of my own mental health crisis, I didn't know whether I was getting well or not. And it was a terrible, terrible place to be. But I think that knowing that I have seen patients become well, I've heard of stories of recovery, there is hope for me. I just have to press on. I do not have to feel that despair that I'm not going to get better. I will get better with time. I can't predict exactly when, and that's really damn terrifying, but I will get better.
Lai Fong, that's one of the reasons that we made the Moving America's Soul on Suicide film, is to give those stories that others could see. And you've been gracious to partner with us on trying to identify storytellers for a second film that would be focused on people in around the world. Talk a little bit about your experience of that film and some of what our challenges and opportunities are on finding those stories for Asia in particular.
Yeah. So I was very moved by the documentary film. I mean, it was really powerful. And I just might take my hats off to the individuals that were so brave and courageous to tell the stories. The impact is humongous. I think that looking for sort of similar people to tell the stories around Asia and other parts of the world, one of the challenges is, of course, whether that particular person feels safe enough to actually share it to the whole world. So I've actually personally reached out to a person who is a trained medical doctor and has shared about her lived experience of suicidal behavior in platforms in the university at a faculty level. But when I said that it was going to be a documentary film, she said that it was actually not herself that she was thinking about. It was about her family. Her family had doubts and concerns about actually sharing so publicly her
Right.
challenges with mental health. So I think that a huge part of the challenge would be stigma, which is still very thick in this part of the world. I think it's thick everywhere, but I think particularly thick in this part of the world. And that we have also sort of challenges with diversity. I mean, if we're talking about the LGBT community and so on
Right.
and so forth. So people in that particular population might not feel that they are safe enough to come out and share their story. So I think that there needs to be so much more advocacy to actually just put it out there that it's okay. Tell your story when you're ready, not when you're not ready, but we're here waiting for you when you are ready to tell your story.
You know, Lai Fong, I love the way you told that, and it does it reminds me of the journey of the LGBTQ population in the United States, where for many years it was unsafe to come out of the closet, as it were, and the initial leaders like Harvey Milk and others who came out, the discrimination was real and palpable, but it was those people that allowed others to tell their stories as we go along. So Jan Mockenstorm encouraged you to have the courage to share, and that you're telling your story will encourage someone else. But for all of us, how much we share or whether we share, it has real consequences in our lives. So, wow, thank you so much. Let's move, John, to our last interactive section. And we didn't do our normally at the beginning of the episode, Lai Fong, we do a super fan section. And John, we're not close enough to Kuala Lumpur, I think, to know what Lai Fong is a super fan of. She did really react to badminton, so I don't know what is your for John it's Taylor Swift, for me it's Formula One. What's your super fan thing, Lai Fong?
I love jazz. I just find
Jazz.
that
Yes.
Did
Please listen to me.
Did you love what was it called? La La Land? Did you see
I
the
watched it.
jazz?
Yes,
Yeah.
yes, I enjoyed it. Yeah, but it was sad. It was
It was,
sad.
I didn't like the sad part. So, John, instead of doing a super fan, you got your piece of paper, John?
Hold on.
John's getting a piece of paper. I'll set this up while he does it.
All
So,
right.
Lifelong, by virtue of us all being in international convenings like IASP and Zero Suicide Efforts, we've had the privilege to be around the world. So, John, Lai Fong has been to many of the places you and I've been. She's also been to places on her own. Where has been her favorite place to visit, John? So we're going to write that down on a sheet of paper.
Country or is it a city?
That's up to you, John. You make up your mind about that.
Oh gosh. Favorite place to visit in the world?
Yes. Favorite place in the world, John. I got mine done, and I missed my shtick for this week. I didn't pre-prepare this. So.
All right.
Count of three. 3, 2, 1.
Whoa, whoa. I say John's the winner.
John is the winner. Where was your favorite place in Italy, Lai Fong?
Oh, Cinque Terre. It's oh gosh, my English is horrible. It's like Positano, where you have all Cinque Terre is beautiful. I mean, I went to Florence for intensive course kind of thing, and then we took sort of like tour to Cinque Terre. It was just beautiful. It was nothing like Malaysia. It was just so surreal with the beach and the cliffs and the rainbow colored houses. It was just beautiful, out of this world.
So I thought I had a leg up, that I had cheated, John. I found Lai Fong on Facebook, and she had a picture of the Ritz-Carlton in Ubud, Bali as her. So I thought maybe
the cheater here, Lai Fong. I mean, but thankfully, cheaters don't prosper here, David.
Well, Positano is a great choice.
Yeah.
But David, I think you got another Lai Fong.
Oh
no! See, that's why cheaters don't prosper, because you're wrong.
All right, so Lai Fong, let's go through a set of places you've been, And love or loathe is too strong. I'm going to give you a little bit of an out on this. It's either travel destination, absolutely, or you could have joined that conference by Zoom. That's all right. So let's start with Peran in Slovenia. Yeah, Zoom or Expedia 5 stars.
Oh, 5 star. Piran was beautiful. It was just, I've never been to East, what you call it? The
Eastern Europe.
Eastern Europe. So that was beautiful.
How about Derry in Northern Ireland?
Oh, that was wonderful as well. There's no way I'm going to Zoom Derry. We went to, I forgot the name of the cliffs of Ireland. It was.
Oh, yeah.
Cliffs of Moher, perhaps?
I don't think so. I think it's another one. I forgot.
But in Northern Ireland, probably it's what's the giant? What is the what? Oh,
yeah, giant
Cliff
something.
of Dover.
Yes, they were incredible.
So this one's a tough one. This was a tough one, Lai Fong.
Okay.
Kuching, Malaysia.
How could I have ever zoomed that? That was like an immersive experience. There's no way I'm going to zoom that.
There were an awful lot of cats there. What was the cat thing about, John?
Cats. I love cats, but so cats are always a thing.
But Borneo was it was spectacular. John and I had the opportunity to be there. What about Montreal, Canada? Were you in Montreal for IASP?
I was in Montreal, and we tried to stretch our dollar and our experience there. We went to Quebec City, and it was beautiful.
Quebec City was. John, do you remember what you and I did in Montreal?
Thankfully, no.
Well, we went to you too.
I know, it was fantastic. We were at the very top, but we saw right through to it was just an amazing show. Great show. They reached us at the very top.
Let's do just a couple more. Oslo,
I miss Oslo. I didn't go. I was still a resident. Didn't have the cash for it.
All right, this one is a loaded question, but Atlanta, Georgia, Lai Fong, John and I, there's only one answer on this, but we're going to give you the chance to get it right.
The peak experience for you.
I nearly didn't go. I only went because my mentor was not so keen on taking a long flight to the US. So I nearly didn't make it, but that trip changed a lot of paradigms in my mind about suicide prevention and how you do suicide prevention. So definitely not through Zoom. This is a totally immersive experience.
That's the correct answer. She got that one right, John.
Yes.
So, John, we've had an amazing time with Lai Fong today. Let's go to our section, back to our sponsor, John. And we're adapting this new section. We're calling it BHL's Absolutely True Tales, John.
Sure.
And I have a slide, an actual photograph of this true tale. John, you were referencing the software platform that BHL now has with, we're working on getting closer and closer to 10,000 users across I think it's 12 states now, John, where the platform is in place. But 20 years ago, I was on a train in the New Jersey area. My ex-wife and she was reading a book, and I was thinking through the second iteration of this software, John. The first iteration brought real-time data to the table, but it was a singular line. So if somebody was calling, crying, frustrated, you were asking them demographic questions because you had to go through this singular sort of story. And I was mapping out, okay, it's got to be agile, more flexible. My ex-wife, who was reading a book, was a software engineer, and she peeks over my shoulder and she says, "You can't do it that way." And I'm like, "You don't even know what I'm doing. You're reading a book." She's like, No, I know what you're doing. And that's not the way you do it. You have to do it this way. And I'm like, okay, I'm not going to do it that way. And then I changed it. And John, you also will notice that I had really great hair back then.
Mm-hmm. Yeah. That's the hair is every bit as likely as that story, David.
John, that story is absolutely true. In fact, you were there, John. After Janine gave feedback, you looked over my shoulder as well and said, in 2020, Dr. Chuck Brownie and I are going to help take that to an entirely new level.
Oh, yeah. Now it's all coming back to me.
John, I think it's time for some good, not some good news. We've done that. It's time for some plain truth, John.
Yeah, I'm happy to give that, David. You know, the International Association of Suicide Prevention, as we were just talking about, has been working on that WHO report to help decriminalize suicide because it prevents people from seeking help. And suicide attempts remain criminal offenses in at least 23 countries worldwide, as we were talking about earlier. This includes various regions, often in parts of Africa and Southeast Asia, which bear a significant burden of suicide mortality. It's been a while since attempting suicide was a crime anywhere in America. How long, you might ask? Well, you may be surprised to hear that suicide or suicide attempts were a felony in 32 states in the 60s, 20 states in the 80s, and 2 states in the 90s. If you presented suicidal thoughts in our mental health system, you were likely to be sent to a hospital or cops would take you there if you didn't want to go on your own. So anonymous hotlines sprung up as a safe alternative in the 60s. That wasn't any caller ID back then. And callers were often talking with trained volunteers, essentially peers, as opposed to mental health professionals. They first launched in California in the early 60s, and by the end of the decade, more than 200 of these alternative mental health services had sprung up around the country. Then the 1990s brought caller ID technology to hotlines, which sparked a lot of controversy in suicide prevention circles. Because, I mean, should hotlines call the police for those at immediate risk of harm without their consent? This practice could shatter the trust built by anonymous hotlines established over the past decades and hark back to times when suicidal actions were criminalized. So let's be clear about this, David. Helping callers to feel safe and collaborating with them to keep themselves safe is the most effective way for hotlines to prevent suicide. Period. Full stop. Fortunately, about 98% of the Lifeline calls are resolved through counselors actively collaborating with people in crisis towards a plan to help them cope and remain safe. And in those 2% of calls where emergency services are needed, most occur with a caller's consent. So why would a suicide hotline ever call 911 without a caller's consent? Here are the few examples of the kinds of circumstances where these active rescues, as we used to call them, can happen. So here's one. A person calls the hotline after taking an overdose of pills with the intent of killing themselves, and they can barely speak, much less tell us where they are. They called us, a suicide prevention line, and they could be dying by suicide right now. What should that counselor do? Well, about 8% of the callers presenting with suicidal issues on the 988 hotline are in the process of attempting suicide. Or here's another one. Imagine a 16-year-old boy contacts the suicide hotline and says he's worthless and he's better off dead. He's overwhelmed with despair, and he says he has a cord he plans to hang himself with right now. He refuses to collaborate with us or his parents to prevent his suicide, and he hangs up. We try calling back, and he doesn't answer. What should the counselor do? Or what would happen when a woman calls the hotline in a psychotic state, claiming that the FBI has possessed her children with the devil? She has a gun and plans to kill them with it today, and then kill herself. She's unable to converse with the counselor, consumed by her delusions. So what should the counselor do? Now look, while these situations may justify calling 911, we're left to ask, what about the suicidal people who will never call us for fear of a 911 response? Hotlines sending 911 may save some lives temporarily, but the policy may also prevent us from ever reaching others that we can help. We need more alternatives to 911 for behavioral health crises and emergencies. And when a 911 response is necessary to save a life, we need a better response. If weapons or a public safety threat is not an issue, sending cops to suicidal people makes about as much sense as sending mental health professionals to break up an armed robbery. SAMHSA will be putting out a 911, 988 interoperability set of recommendations in the next few months. I'm privileged to be on that advisory task force, along with other behavioral health, law enforcement, and 911 leaders. It'll provide clear guidance for communicating to the public when to call 911 and when to call 988, so we get the appropriate response for our behavioral health needs. It will also provide recommendations for diverting unnecessary 911 behavioral health calls to 988 centers. For example, in Austin, when you call 911, you're asked if you need police, fire, EMS, or mental health services. with non-emergent mental health calls going to the local 988 center. And then on the other side of it, when 988 calls need a 911 response and someone could die if we don't act, sometimes we only need EMS. And if we need police because a public safety threat is evident, we don't just need guys with cuffs and guns. We also need a compassionate presence on that scene, someone there who's trained to help people in behavioral health crises. After all, in America, we decriminalized suicide decades ago, and a mental health crisis is not a crime.
Wow, that's some plain truth, John, and a real lifeline. And hard work, but we're going to do that better as we have people with lived experience helping design and guide that. And we have the immense privilege today to have our guest, Professor Chan Lai Fong, with us. Thank you so much for joining us late from Kuala Lumpur. And I hope everybody will join us again next week, John, when our guest will be Willie Whitehead, one of the staff at the original City of Atlanta hotline forged all the way back in 1966. Thanks for letting us pull you in this week, and join us next time when we continue to navigate the currents of crisis and care. Until then, remember, every call, every life, every story matters. Stay connected, stay supportive, and we'll see you on the next Lifelines.